My name is Simon Maina, the coordinator, the Community Program for Children in Need at St. Martin. And I would wish to greet all of you at this time when we are dealing with this challenge of COVID-19. We have found it even challenging to have children get into our centers, admitting new children into our centers. And according to the government directives that we received at the beginning of this pandemic, we were requested not to allow any contact with the outside world, with the children who are already in the center. And for this reason, the children who are coming from the streets or children who could be rescued because of abuse cannot get into our centers. And we had also to come up with an arrangement with the staff. There are staff who are permanently in the center at the moment, and we are in agreement with them that they have to remain there up to a time when they can be relieved, so that they don't get out and get in and bring in the issues of COVID-19. Children are somehow not also at a very good time in terms of their psychological needs, because they are somehow bothered. And the issue here is that they would want to understand the situation of their parents at home and the situation of the other children at home. So what we are doing, we are encouraging the parents. We are talking to the parents through phone, encouraging them to visit us, not to come and see the children, but to get into contact with us so that we can get the information of how they are doing at home. And at the same time, we were also requested to have more and more children reintegrated, and especially those who had maybe been with us for some time and they had undergone rehabilitation. So parents who are agreeing, they are coming to the office and taking these children from the office and going with them. We found it a little bit more better when they come, and even when the children go to be with their family, because the stress level somehow goes down. However, we have a population of children who cannot be reintegrated at the moment because they are either in conflict with the law or the situation at home is not conducive. And then at the same time, the social workers cannot move a lot, and especially outside the target area. We would be happy to have the children back with their family so that they can be able to deal with this situation together as a family. However, we have also introduced activities in the center. First, we are bringing in the issue of hygiene, creating awareness on coronavirus to the children and helping them adopt hygiene activities. We have introduced washing points in the center. We've also kept informing them why they can't get out of the center. It could be stressful for them because, like on Wednesday, on a normal day, they go together to join other communities for mass. On Sundays, they also go to church. This can no longer happen. And them remaining in the center, we have to be more creative to see that we take church to them. We introduce them to activities that can be more engaging for them, and also to keep them connected to education, because even those who attend school cannot attend school at the moment. They have to remain in the center, and the teachers have to keep them busy, giving them information and also preparing them, and especially for those that could be doing exam this year, because the government has made it clear that the exams will not be cancelled. Now, the situation also, even in terms of how we are functioning in the program, has also interfered with our normal way of working. A lot of time for the social worker is now dedicated to working with vulnerable families in the community. And we have come to learn that there's a lot of suffering among family members. These families are families that we could say they live from hand to mouth. And now that there's a lot of casual work and businesses that are now no longer functional. For example, those who go to the market is now working under a very strict program. Some of them who sell food in the evening, they can't do that because of the curfew. Those that work in hotels cannot work because we can no longer go to hotels to eat. So, and those even who go for casual labor, the casual labor is not that available at the moment. So we are in a situation where there's not enough food at home, and there are families that are going for days without meals, and there are families that are also relying on other families to support them in terms of what the children will eat. We have a project in St. Martin at the moment that is trying to reach out to around 200 families, of which 50 of them are from the Street Children program. And these families have been reached, and they've been supplied with food that can take them for about a month. We are hoping the situation will improve. So thanks a lot even for the support, and we're also praying for you wherever you are, and especially even our partners in Germany. We can see the struggle that is there in Europe, and we are with you. We pray for you. Asanteni.